My name is Tom Thrane. I'm a gastroenterology registrar currently working at Kingston Hospital. But I'm presenting work from the Institute of Liver Studies on behalf of Godev Manikat Vijay. As previously alluded to, he's working over on mouse models of this work in Yale currently. We've got no conflicts of interest to declare. And today I'm going to be talking about the role of neutrophil toll-like receptor 9 expression and the systemic inflammatory response in paracetamol-induced acute liver failure. So acute liver failure, it's defined as the onset of acute severe liver injury with complications of coagulopathy and encephalopathy in a patient with no previous known history of liver cirrhosis. And paracetamol-induced acute liver failure is the commonest cause of acute liver failure in the Western world. And what we see here is the multi-organ involvement of this condition and the intensive care support required for these patients. What we see is that loss of hepatocyte synthetic function leads to a circulating hyperammonemia through decreased ammonia detoxification pathways, as has been previously explained. And hyperammonemia has been shown to have a causative role in the development of raised intracranial pressure. And this cerebral edema that we see in acute liver failure can occur in up to 25% of patients presenting with acute liver failure. And they can progress through to the higher grades of encephalopathy and even through to coma and death, at which point this is where they need emergency liver transplantation. What we also see in acute liver failure is that there's a marked propensity towards the development of sepsis in acute liver failure. And we see innate immune system dysregulation proceeding towards the development of sepsis. And sepsis itself can have a superadded influence in terms of driving forward encephalopathy and inflammation. In fact, neutrophil function indices as well, in terms of the innate immune system dysfunction, neutrophils have shown to be impaired in acute liver failure. And actually they do prognosticate in acute liver failure as well. And neutrophil phagocytic capacity correlates with the chance of proceeding towards liver transplantation or dying of your acute liver failure. We also see that neutrophil phagocytic capacity is related and correlates quite strongly with arterial ammonia concentrations. And there's a growing body of evidence to suggest that arterial hyperammonemia is causative in its development of neutrophil dysfunction. Moving on briefly just to touch on toll-like receptors, there are a variety of toll-like receptors described, all of which, with the exception of toll-like receptor 3, are expressed in neutrophils. With particular relevance to this study, we were looking at toll-like receptors 2, 4 and 9. 2 and 4 expressed on the cell surface responding to gram-positive and gram-negative bacteria, and TLR9, which recognizes the CpG motifs of bacterial DNA. And they activate on downstream pathways, terminating on NF-kappa B pathways and the increased transcription of pro-inflammatory cytokines. With particular respect to neutrophils, toll-like receptors have been shown to increase the phagocytic capacity, superoxide generation, L-selecting shedding, and cytokine release in neutrophils. And although TLR9 hasn't been specifically looked at in the context of paracetamol-induced acute liver failure with respect to neutrophils, knockout mouse models of TLR9 have been shown to be protective in paracetamol-induced acute liver failure models. So our hypothesis was that circulating neutrophil TLR9 expression might be increased in paracetamol-induced acute liver failure patients with a systemic inflammatory response syndrome, or SIRS, which results from the release of necrotic hepatocyte products, circulating hyperammonemia, and interleukin-8. And our aim was to characterize circulating neutrophil function and also to measure toll-like receptors 2, 4, and 9 expression, and also to measure cytokine production, both in healthy controls and in patients presenting with paracetamol-induced acute liver failure to the liver intensive care unit. And we were doing this both at baseline and following stimulation with bacterial products such as LPS and also ammonium chloride. In a separate experiment, we looked in healthy controls at the effects of interleukin-8 and ammonium chloride on TLR9 expression. So we recruited 24 patients with paracetamol-induced acute liver failure, and samples were taken on day 1, i.e. within 24 hours of their admission to the liver intensive care unit, and then they were followed longitudinally through days 4 and 7 to outcomes of recovery, liver transplantation or death. And this was compared against 10 healthy controls. And we were sampling peripheral blood from these patients and studying neutrophils ex vivo. It was a flow cytometry-based experiment, and we were using monoclonal antibodies directed against toll-like receptors 2, 4, and 9. And we were also studying plasma cytokine levels using cytokine bead array and testing neutrophil dynamic function with phagocytosis and oxidative burst assays. So in terms of the demographic data, what we saw is that about a third of the patients presenting with acute liver failure were eligible, meeting criteria for liver transplantation. And what we also saw was that looking at their organ severity scores and their inflammatory scores, there was about a 50-50 mix between the lower and higher grades of encephalopathy that they were presenting with, and also the lower and higher grades of SIRS scores. Looking at their biochemical parameters as well, they were markedly deranged on day 1 alongside their organ severity scores, but this was normalizing towards day 4 and 7. And the first observations we made were that neutrophil functional indices were impaired in patients presenting with paracetamol-induced acute liver failure. At day 1, they did have decreased phagocytic capacity and increased reactive oxygen species production. Taking this forward to look at the toll-like receptor expression, what we saw was that toll-like receptor 4 was significantly decreased on day 1 compared to healthy controls, and conversely, toll-like receptor 9 was significantly increased. And then looking in graphs D, E, and F, what we see is the inflammatory burden and interleukin 6, 8, and interleukin 10 respectively, and they're all markedly increased on day 1 in paracetamol-induced acute liver failure. Some important negatives was that there are no differences in toll-like receptor 2 expression in paracetamol-induced liver failure when comparing against healthy controls. And both in healthy controls and patients, plasma endotoxin levels, as measured, were below detectable limits. Looking more closely at the correlations between ammonia and interleukin 8 and TLR9, we found that TLR9 expression was significantly correlated with arterial ammonia levels and also levels of plasma IL-8. However, this was not true of toll-like receptor 4 expression. Taking this to the bedside, what we also saw, therefore, was that if we separated the patients with paracetamol-induced acute liver failure and compared the ones with the low SIRS scores and the high SIRS scores, what we saw was that toll-like receptor 9 expression was significantly increased on day 1. And that was also true of the hepatic encephalopathy scores. That kind of reflects this correlation we're seeing between ammonia and interleukin 8 and toll-like receptor 9 expression. This was also true of the interleukin 8 levels that we saw in patients with the high SIRS scores and the high encephalopathy grade scores. So taking that forward, to try and identify a causative relationship between interleukin 8, ammonia, and neutrophil TLR9 expression, we did some ex vivo studies on healthy control neutrophils, and we stimulated these neutrophils with either ammonia or different concentrations of interleukin 8 that reflected the levels that we were observing in paracetamol-induced acute liver failure. And what we saw was that there was no significant difference in TLR9 expression when stimulated with either ammonium or the different concentrations of interleukin 8. However, when we synergistically stimulated these patients with ammonia and interleukin 8, what we saw was significant increases in toll-like receptor 9 expression. And this was actually most marked at the lower concentrations of interleukin 8. Taking that back to the controls, we then looked towards bacterial stimulation with lipopolysaccharide of these patients, and again separating them out between healthy controls, patients with lower SIRS scores, and patients with the higher SIRS scores. What we saw is that in healthy controls and low SIRS score patients, there was no significant differences in TLR9 expression after bacterial or ammonium stimulation. However, in the patients with the higher SIRS scores, TLR9 was decreased. Again, that was reflected in the patients with the higher hepatic encephalopathy scores. And taking that forward to look at the responsive pro-inflammatory cytokine production, what we see is on the left-hand side is healthy control data for interleukin 8 and TNF-alpha production. And healthy controls were able to significantly upregulate TNF-alpha and interleukin 8 in response to LPS challenge. And this was also true of patients with paracetamol-induced acute liver failure with low SIRS scores. However, the patients with the higher SIRS scores, the higher TLR9 expression, weren't able to upregulate their cytokine production. And we saw similar results, although not significant, with ammonium stimulation. So in summary, what we're seeing in, what I believe we're seeing in paracetamol overdose is that hepatocyte necrosis and the release of hepatocyte products causes a circulating hyperammonemia and a pro-inflammatory state of interleukin-8, which recruits and activates neutrophils, which produce cytokines. What we're seeing is that TLR9 expression is significantly upregulated, and this correlates with the degree of inflammation and the hyperammonemia that we see. When we then expose these neutrophils to further bacterial challenge, what we see is that these neutrophils appear to be exhausted and unable to mount further cytokine responses, which may render this patient susceptible to the development of sepsis and multi-organ failure, which is what we commonly observe in these acute liver failure patients. So this work is now being taken forward in terms of TLR9 mouse models at Yale University under Professor Lee Wen and Professor Majahat Mehal. I'd like to thank the contributing authors, and I'd like to thank you for your attention.